Good morning. I'm JeongHwa Oh, the Deputy Manager of Pharmaceutical Information Service Center at Health Insurance Review and Assessment, so-called HIRA, in South Korea. It's a great pleasure to be here with you today. I will be introducing the progress and status of pharmaceutical serialization and traceability system in South Korea. But first, I'd like to give a brief background of KPIS or KPIS. KPIS was established in HIRA 10 years ago in order to manage the distribution of drug-related information. The purpose was to increase transparency with respect to distribution of medicine within South Korea. The center manages standard data carriers, collection and management of distribution information, and the serialization of all prescription drugs within established system with the Ministry of Health and Welfare, which is in charge of the overall policies and decisions regarding the drug supply chain in Korea. I'd like to talk about three main topics today. The presentation will proceed as you do see on the screen. The first topic is about the standardization of pharmaceutical information within South Korea. In South Korea, GTN is typically referred to as the KD code or Korea Drug Code. Let's take a look at the process of assigning a KD code. A pharmaceutical company applies for a KD code for all drug products at KPIS within a month of MFDS approval acquisition. In order to do this, a company must be assigned a unique company code from JeongHwa Korea. After that, KPIS Center announces the requested standard code to the homepage within 10 calendar days. The table in bottom right-hand side of the presentation is an example of KDC. It consists of 13 digits. For your reference, GS1 prefix for all medicines distributed in South Korea start with number 880. All drugs distributed in South Korean market are required to have GS1 barcodes or RFID EPC tags within encoded the KD code. Current prevailing law states that every primary packaging label must have a barcode or RFID tag. When marking drug products with barcodes, GTN or JS1 application identifier is required to be used. If you want to use RFID technology, SGT96 or 189 coding structure must be used. Currently, 16 pharmaceutical companies are using RFID technology, while over 96% of pharmaceutical companies still use barcodes as data carrier. This is a classification of the JS1 barcode symbologies that can be applied by drug category. OTC or over-the-counter drugs are required to have GTN encoded in the JS1 data matrix or EAN barcodes. And ATC or prescription drug must have GTN expiration date, batch number, and also serial number using either JS1 data matrix or JS1 128 barcodes. The next topic I'd like to talk about is the National Pharmaceutical Serialization System. In accordance with the policy set forth by the National PSS, a unique serial number is required to ethical drugs on every primary package level. First, once a pharmaceutical company begins producing drugs, each drug packaging is affixed with a serial number. Second, for practical convenience, all aggregated packages typically including an aggregation code. A company manages all of its information digitally, which allowed for convenience reporting, tracking, and analysis. Packages stored in warehouses are required to have their respective GTN and serial numbers reported along with the KPIs when shipping via file upload, manual entry, or ESP agent. The report registration must be completed before the buyer receives the goods. Currently, it allows up to 2 days, including delivery date. KPIS provides a service to link a seller's shipping information to the buyer in real time. As a result, buyers are able to conveniently track delivery before inventory is stored at the warehouse. Throughout this process, the regulator is also able to track and trace its prescription drugs. The South Korean government has been planning the implementation of serialization regulation since applicable law were passed in 2011. Furthermore, since the year of 2015, all prescription pharmaceutical drug packages manufactured in or imported into South Korea are required to have serial numbers affixed to its drug packages. And since January 2016, all prescription drug packages must now be registered to the KPIS at the time of shipment. It should be noted that supplementary provision is allowed. Reporting is allowed by the end of next month following the transaction until last day of June 2017 for wholesalers. And administrative measures or public measures will be applied when these guidelines are violated, which was applicable for manufacturers and importers starting in 2017, though wholesalers have a grace period until January 2018. Currently, pharmaceutical companies are in phase 3, and as a result, they are required to register transaction reports at the time of shipment. However, wholesalers which are still in phase 1 are allowed to report by the end of next month. It should be noted that on July 1st, approximately 3 months from now, wholesalers will be required to, by law, to register the report upon shipping. The graph on the left of the presentation provides the number of serialization on ETC drugs at the end of 2016. Last year, we conducted 3 on-the-spot surveys and note that as time went on, the rate of affixing serial number encoded barcode increased. The average affixing rate for 2016 was just over 92%. The other graph on the slide indicates the number of pharmaceutical companies that registered transaction record at the time of shipment. The rate of pharmaceutical companies reporting transaction with a serial number during the second half of 2016 gradually increased from July to October, although the rate fell by just 1.5% in November and it soon recovered, reaching 99% in December. As of 2017, the participation rate is maintained as high as 99% or more. This chart represented the flow of data linkage on the reported transaction records. For each prescription process, we provide real-time linkage of data submitted by the seller to the buyer. This real-time linkage takes place in all forms of supply, from direct transaction to healthcare provider, transactions between pharmaceutical and wholesalers, transactions between wholesalers, as well as transactions between wholesalers and providers. The last topic I will be covering today is related to the traceability system in South Korea. KPIS takes a central role for pharmaceutical distribution information. We established the data warehouse that comprises a variety of information on pharmaceuticals. The primary purpose of DW is to provide data through integrated analysis. For instance, KPIS analyzed drug supply and consumption data in order to generate public value by identifying nationwide vaccine reserve to combat communicable disease, and support policymaking processes such as drug pricing. In addition, we notify supply about unsafe or recorded products. This data can be used to identify future trends of pharmaceutical industry. The pharmaceutical industry will gain many benefits by adopting a traceability system. For example, serialization is able to help verify and authenticate products, meaning that it can help detect and minimize the impact of counterfeit products, which ultimately help maintain a company's brand and reputation. Another added benefit is that it allows distributors to manage logistics more efficiently by allowing companies to easily check data of the medicine delivered via the data linkage service, as well as allowing companies to be able to accurately detect and return any recalled medicine. Serialization can also allow the medical institution to build trust with patients, as it can prevent the use of counterfeit or illegal medicines. Using this information as a confirmation procedure for each patient's medication at bedside can help reduce medical errors. Pharmacists can also manage the expiry dates of medicines, as well as save money through accurate inventory controls. Aggregation is a packaging and logistics functionality which is used to create parent-child relationship throughout packaging hierarchy level. For instance, distributors may ship products with aggregation code, and the KPIS is able to provide detailed information, including GTN and serial number, through the AG data linkage service, which can help to reduce the delivery time. However, in order for distributors to take advantage of this practical convenience, the pharmaceutical companies is required to submit low-level information about the AG to the KPIs. Although AG barcode labeling and data reporting is optional, we strongly recommend its use, as we believe it promotes efficient distribution flow. We are planning to provide safe check service to citizens through the smartphone application subsequent to July 2017, once all distributors have commenced registered of distribution information, including serial number data. KPIS provides a safe supply chain service by using registered pharmaceutical data, and it ensures safety and satisfaction of the products of the nation. Thank you for your undivided attention. If you have any question, feel free to contact me. Personally, I prefer to get an email. Yeah. I hope that everyone today found the presentation informative and easy to understand. Vielen Dank.